Okay, good afternoon, everybody. Welcome to the Pima County Health Department School Health Update. Want to wish everybody a very happy new year. This is going to be our first one for this new year. I wanted to also let everybody know that the meeting will be recorded. I can also turn off the recording when we get to the Q&A session towards the end. But I also want to let you know if anybody has their microphone on, can you please mute that while the presenters are presenting? And also you can raise your hand if you do have a question after one of the presenters is presenting, and we will answer that. I'm going to step in here to our agenda. And also those who are new to the School Health Update, welcome. And also if anybody who is not new or anybody who wants to please put their email and name in the chat, that would help us for our records. And here's our agenda. So I'm going to start off with our announcements. We do have our EPI update. And then we have norovirus prevention. And then we do have a Teen Lifeline is going to be also presenting today. And following all those presentations, we will have a Q&A session that you all can answer or ask questions, and we can answer for you. So far for our announcements, we do have our monthly newsletter. That's going to be the Pima County Health Department monthly newsletter that you can sign up. You can click here. All the announcements do come up, and anything that's in the newsletter, you will see that here probably shortly coming out after the health update. And we regularly have ones that can you can go over additional information on that newsletter. So what we're going to do, we're going to start off with our EPI update. I believe Megan will be presenting with us today.
Yes, thank you, John. I am here and ready to provide you a respiratory update, COVID-19, RSV, and influenza. Next slide, please. So here's our overall of all three morbidities. You can see here on this chart, pink is RSV, yellow is COVID, and flu, that big line is blue. It's influenza. It's spiking. Let's go into further details. Next slide, please. First, we're going to start off with RSV. This is a more detailed information. It is a little misconstruing when it says that we've gone 94% less than usual, which is true. But we have not had that large spike of 167% more than the prior week. We are still looking at just 8 cases. Total all this season, we have only had 30 confirmed RSVs. So we are still staying fairly low, especially compared to last season and the overall average of the season. We are staying very low, which is absolutely wonderful. We love to see it. Next slide, please. All right, here's our influenza. It is spiking. The past 2 weeks, it has doubled each week. We are seeing it spike. We are still below our average for the total all season compared to last season, but we are approaching it. This is the time of year we do expect this spike, but these are spiking much more faster than we saw last season. So definitely, if you are feeling ill, we do recommend stay home, get tested, wash your hands, cover your face. Some facilities are requesting, especially Banner, to be wearing masks to help prevent the spread. Next slide, please. And here we see COVID-19. The 5-year average does get cut off because of how high it did go at the beginning of the pandemic, and those numbers are still included. But this season, we are still remaining consistent with COVID. We aren't seeing any huge spikes that are occurring, but it is still out and spreading in the community. Next slide, please. And these are the wonderful posters provided by CDC. You can click on the images once you get the slides. Great showing of covering your cough, what it looks like, and when to wash your hands. These are both available in a wide variety of languages. I highly recommend that you print them out and post them around your schools, just as a gentle reminder for folks of what to do during this time of year to help stop the spread. Next slide. And here are our recommendations. Again, we definitely recommend keeping up to date with your vaccinations. Most people are eligible for COVID and flu vaccines for this season. And then RSV is definitely available for infants. When people who are carrying an infant, a child, and pregnant, they can get vaccinated, as well as those who are 60 years and over. Again, talk to your providers. If you need assistance, please give us a call. We'll give you whatever resources we have available, and definitely talk to your provider and see if what vaccines are available. Also, good hygiene practices. We just showed those two posters that are very helpful. Washing your hands or using hand sanitizer, covering your coughs and sneezes, and wiping down those frequently touched surfaces will also be monumental to help stop the spread of these respiratory diseases. Also, cleaning your air, making sure we're using proper filters and purifiers. If we can meet outdoors, that's even better. If the illnesses become an outbreak situation or they continue to increase, wearing a well-fitting mask, if it's appropriate, will help you prevent your sickness being spread, as well as you can getting sickness from others. Also, increased physical distancing is also something that we recommend, especially if you're feeling ill. Stay home when you're sick. Wait to return until your symptoms have started to feel better, or that you've also not have had a fever without using any fever reducing medications for 24 hours. Testing is also incredibly helpful. You can find out what respiratory illness you are having. I know we all want to say, oh, it's allergies. That does happen, but just to make sure you're not spreading influenza or COVID or RSV to others, and that it truly is allergies. There's combo tests out there, so you don't have to have multiple swabs. And of course, there's always treatment options. Definitely talk to your primary care physicians or pediatricians, and you can recommend that to parents of your students to go ahead and see if they need any treatment. It is always best to get it within 5 days of when you've been sick or tested positive. Next slide, please. This is our last slide from Epi. In between these monthly meetings, if you have questions about any morbidity, ADHS has a wonderful mobile app as well as a flip chart for computers that you can go through and look at different diseases. ADHS as well as Pima has respiratory data on their websites. The two linked are there. COVID-19, or sorry, not COVID-19, it is on this list too, but CDC has vaccinations and immunization schedules for kiddos, those who are in the process of getting vaccinated or need kind of a catch-up series. Also for adults are also linked here, as well as CDC's it's an all-encompassing respiratory virus prevention with the links to all of the updated immunizations there. If you have questions, please give Pima County Health Department Epidemiology a call. There's our phone number as well as our email. Thank you, John.
You're welcome, and thank you so much, Megan, for your updates here. It's very important to understand that you can get in contact with EPI through those information that we have shared here with you. All right, so we're going to go to our next presenter. This is going to be Cecia Estrada. She's actually with our chef's program. You on, Cecia?
Yes, I'm here. Thank you, John.
You're welcome.
Hi, everyone. Good afternoon. So I'll be speaking a little bit about norovirus, or how we commonly all know it, the stomach bug, and how we can keep an eye out during or in our schools. Next slide. So what is the stomach flu or norovirus? It's usually what causes you vomiting and diarrhea. We see high peak outbreaks of norovirus during the months of November all the way to April, and it disrupts a lot of school operations due to student absenteeism, finding or looking for staff to substitute and things of that nature. You can get sick from norovirus from sick people and through contaminated food, water, and surfaces. The number one prevention tip is to wash your hands thoroughly. It is known that norovirus is resistant to alcohol, so hand sanitizers are not effective against it. And then, as a reminder, just like with respiratory illnesses, staying home when you're sick will be key to avoid contact with others and avoiding food preparation until at least 48 hours after symptoms stop to prevent spreading the virus. Next slide. So here's a quick YouTube video that I think it's a very nice visual to better understand how this quickly spreads. Because we can't see it with our naked eye, it's easy to misunderstand how quickly it spreads. So if you can go ahead and play it. So as you see, that can be very happens very quickly, especially in school settings where sometimes younger children might have a harder time understanding personal space or hand washing. This is how sometimes we see a lot of high um, gastrointestinal outbreaks in school settings. And last year we saw a huge rise during this time when everyone was back to school. We saw a huge rise from January, I think, up to March. So we want to prevent as much as possible being in that space again. Next slide. Here's another quick YouTube video. On the previous one, I didn't hear audio, John. I don't know if you have to unmute for us to hear to listen to this audio. This just kind of elaborates more on what I previously shared, but with visuals that I think it's pretty neat to look at.
Okay, let me try to make sure it goes through again. I'm going to play the video now.
No
Do you hear it?
audio.
No audio.
No. I think when you share, you might have to unshare, and then when you click share, it says share audio.
I understand. Let me try again. Just 1 second. And then share. Oops. This one, yep. Right. Got it. Okay. All right, thank you for that. Let's try it again.
Norovirus is a germ that spreads quickly and easily from a sick person to others. It causes vomiting and diarrhea that come on suddenly, often before you can get to a bathroom. If you get sick from norovirus, you might splatter drops of vomit or poop from many feet in all directions. Norovirus symptoms can strike any time, any place. You could be at the fair or out shopping. It's extremely important to clean up the entire area immediately after you vomit or have diarrhea so others don't get norovirus. Cleanup must be thorough to not miss any drops of vomit or poop that can't be seen. Here's how to clean up after someone vomits or has diarrhea. Step 1. You don't want norovirus to get on your hands or in your mouth while cleaning up vomit and poop. Protect yourself. Put on disposable gloves and a mask if you have one. Step 2. Wipe up vomit and poop with paper towels and put them in a plastic trash bag. Step 3. Pour bleach cleaner on all surfaces that may have vomit or poop on them. Leave the bleach on surfaces for at least 5 minutes. You can use a chlorine bleach cleaner or make your own by adding 3/4 cup of bleach to 1 gallon of water. Step 4. Clean all surfaces again with hot water and soap. Step 5. Remove your disposable gloves, throw them away, and take out the trash. Step 6. Remove and wash all laundry that may have vomit or poop on them with hot water and soap. Step 7. Wash your hands with soap and water and call it a job well done. Help squash norovirus. Always clean up the entire area immediately after someone vomits or has diarrhea. Learn more at cdc.gov/norovirus.
Thank you, John. So next slide. This visual really helps. These videos I thought were very good to kind of gives an overview. I know that when we've addressed outbreaks at schools, because there's a lot of students that are sick, including staff, we go on site to do assessments and kind of evaluate where there might be potential areas that might be making the outbreak spread even more. And during these assessments, we found frequently that facilities will use the incorrect disinfectant. So here's an example. Here on the right, you can see disinfecting wipes, and they'll have statements like kills cold and flu viruses and has kills 99.9%. And oftentimes that 0.1% is norovirus. Norovirus is very hard to kill. So having the proper equipment and disinfectant will be extremely helpful in this situation. Right here, you'll see an EPA reg number. This is something that you can grab and enter into this EPA table, and it will let you know if that disinfectant or chemical is effective against norovirus. Right here on the left, I gave an example of something that is effective. So from this little screenshot, you'll see EPA number, reg number 1677259. When you enter into that table, it pulls up in this search engine, and it'll tell you how long to leave the disinfectant on that surface. So for example, this one has a contact time of 30 seconds for it to keep the surface wet in order for those norovirus particles to die. Here's the QR code that you can scan, and it'll take you to this search engine for you to look up your disinfectants. And like the video states, the very most cost-effective alternative is bleach, but I do understand that schools have some limitations on what chemicals that can be used in campus. So working with your facilities management, your janitorial staff, your nurse's office, admin staff will be extremely helpful. So you're all on the same page to understand what chemicals will be good when there's an outbreak or potential outbreak going out in your school. Next slide. Here are some tips on areas to keep in mind during an outbreak, or if you suspect there's an outbreak going on in school. So it's tackling those high touch surfaces, again, using that effective sanitizer, using that in all areas, not only the classrooms, but the sanitizer that's also used in the kitchen area where with the dish machine or 3-compartment sink. Focusing on frequently touched surfaces, this includes desks, door handles, shared supplies, sink handles, toilet handles, store any handles, anything that people might touch, tables, seat, benches, milk cooler handles, water fountains, bottle filler buttons. And then best practice to prevent cross-contamination is to clean affected areas last. So that you're not spreading the germs where you know there are classrooms with sick kids, and you're not taking that into classes that there's no affected staff or students that are sick. And some other recommendations is for affected areas, use gloves, change gloves between rooms, and wash hands after removing gloves. Using separate cleaning equipment if possible, or disinfect after use between restrooms and classrooms. Because as you see, those particles are usually always more prevalent in the restrooms where kids might have accidents, vomit, or diarrhea. And then cafeteria employees, just a reminder to no bare hand contact while handling food. Next slide. Another recommendation is during active outbreaks is limiting high-risk activities. So this includes pausing on group gatherings and assemblies, such as potlucks, PTA concessionaire sales, pause share meals and buffet style items such as like the salad bars in the cafeteria. If there's snacks in the classroom, resorting to individually prepackaged snacks, limiting shared items. This can include more frequent cleaning and disinfection between throughout the day, or creating like a clean bin versus a used bin. Other things are limiting use of common areas. If possible, staggering schedules of lunches to avoid having a big group of students all at once at the cafeteria. Improve ventilation, air filters, opening doors and windows if the weather allows. Another thing is pausing field trips or offsite events if there's an active outbreak to prevent this from spreading beyond the school to the community at large. Next slide. And so in conclusion with this presentation, it's that our shared goal is to have our communities be safe in general, preventing students, staff, and families. And we can't do this by ourselves. We need one another. So strengthening our partnership through open communication. If you do suspect an outbreak or have any questions, knowing that we are here as a resource and can help you connect with another team if needed, that might also be helpful. And taking action as much as possible, because we know that sickness will come. It's just a matter of when, and being equipped will help you hopefully make the outbreak end quicker and sooner. But that is all I have. I think the next slide is just a slide with QR codes for resources, if for free handouts that kind of promote hand washing, vomit and fecal instructions on how to clean that up, and videos that you can share with students that are young age appropriate and will be engaging for them to understand the importance of hand washing. But that is all I have. Thank you, John.
Thank you so much, Cecia, for that informative presentation. I'll leave this up just for a couple of minutes, couple of seconds here. If anybody wants to take these quick little screenshots here for your use at your school. And then we were going to go for our last presenter for the day. I'm going to go to their slide. Sunday Hamilton, representing Teen Lifeline, is going to present with us. And this is actually going to be a new part of our school health update, where we're going to be sharing youth mental health resources. Sunday, are you on the line?
I am.
Thank you, Sunday.
Awesome. Thank you, John. Hi, everyone. My name is Sunday, and I'm here with Teen Lifeline to share a little bit about our programs and the peer counselor experience with the start of the new semester. Next slide. So just a little bit of background on Teen Lifeline. It was started in 1986 in Arizona, when Arizona was ranked second in the nation for rates of teen suicide. At that time, there were no youth-centered resources. And so folks came together and decided that through data, through communication, that having a peer-led hotline is what youth wanted, is that who they wanted to speak with was other youth. So through that, Teen Lifeline was born. In 1999, we received 501(c) status, and more recently have moved, it started in Phoenix, but has moved down to Pima County. So I am the clinical preventionist that works in Pima County. Next slide. Perfect. So just a little bit of background. Our mission is to strengthen resilience in youth and foster supportive communities. And our vision is for all youth to present a sense of connectedness and hope for their future. So we're here to support and prevent youth suicide. Yeah, in Southern Arizona. Next slide. So how we do that is with our main service, which is a peer counseling hotline. It is open 365 days a year and answered by youth. So folks are able to call or text the hotline any day of the week from 3 p.m. to 9 p.m. And that is going to be answered. Any call or text is going to be answered by a youth. It is free, anonymous, and confidential for anyone to use this resource. The youth on the line are supervised by master's level clinicians, excuse me. So I'm a supervisor for our youth down here in Pima County. And again, it's 365 days a year. So on a Saturday, on Christmas, on any major holiday, there is someone there to answer a text or a call from 3 p.m. to 9 p.m. Next slide. So some services that we also do outside of the hotline or collaborating with the hotline is our life skills. So any teen who is wanting to be a peer counselor to work the hotline will do our life skills training. It's a volunteer training and it's youth 15 and older. They do about 72 plus hours of training in order to be able to be on the line. And are able to come in as they would like to support. Again, our peer counselors answer any calls and texts from our youth or anyone that's calling in crisis. Cool. Next slide. Perfect. Other ways that we support is through prevention, prevention and outreach services. We have a number of community education workshops for classrooms, for middle schoolers, high schoolers, training for adults and parents, both virtual and in person. We're able to train with Mitch Warnock Act compliant trainings. So a lot of different services. We have an ID initiative, and at this moment, Teen Lifeline is on the back of every TUSD ID for K-8, middle school, and high school students. So if you flip over their student ID, our number is on the back. And then we also offer services post-vention. So if there has been a death of a student, staff, community member, and there are services or support is needed, Teen Lifeline is there to support in that way as well. Next slide. Perfect. So just a little bit of impact. Since 1986, our peer counselors have taken 999,000 calls and texts. Over 1,700 youth have been trained. And we've been able to reach a number, millions of school staff and parents and community members, and are hoping to build that connection and collaboration here in Southern Arizona. Next slide. Okay, so just another reason why Teen Lifeline is so special and important is just who do adolescents go to for help? And the research shows us that adolescents want to go to their peers. 85% of students said that they would turn to a friend or a peer if they had a problem. Yeah, students may not receive any support from the adults in their life. And so this is why this service and Teen Lifeline is so special and important, is because in that crisis, or even if someone is just needing to talk to another person, they're able to talk to a peer and someone their age versus an adult. Next slide, please. Perfect. A little bit about how our youth, question is like, how are your youth on the line trained? So the training is broken up into 3 phases. Obviously here, phase 1, phase 2, and phase 3. We'll go to the next slide. Perfect. So our phase 1, actually, sorry, one more slide. Thank you. During our phase 1 is when we bring any youth who are interested in becoming a peer counselor, and we will have a weekend where we go over the 5 basic skills of communicating. Minimal encouragers, paraphrasing, closed questions, open questions, and reflections. We will practice what that looks like. We will do a lot of back-to-back role plays and really get the youth just started on thinking about ways that they can respond, how to paraphrase, how to reflect back what that person's saying, how to get correction on, is this correct, what I'm thinking? Next slide, please. Great. After that first weekend, phase 2 is a longer phase of the training. And each week during that time, youth are trained on each of these 6 topics: pregnancy, sexuality, abuse, runaway, suicide, and mental illness. Each week that we have a training, the youth will also do a phone call role play with me and another person. We will go over it, make sure they are hitting points. They'll get feedback, I'll get feedback, and they will do that until they're ready to be on the line, till they feel confident and we feel confident that their skills are all set. Okay, next slide. And then one of our most important things, or our key components to our hotline calls that we teach throughout that phase 2, is making sure that the callers are safe, checking for their immediate safety. We want to build a connection using those 5 basic skills. We want to help the folks that are calling be able to identify the safe adults or people in their lives. And then lastly, we want to support them in creating an action plan and empowering the caller to be able to enact that action plan. And eventually we will do a check-in. Okay, next slide. Perfect. So just a basic example of what a call may look like, or the call flow on our end. When a caller calls a hotline, our youth will build a connection, doing that through using voice tone, active listening, asking questions. We'll want to figure out what's going on. What is the problem happening today? We will ask questions to dig deeper into that. Once we've identified the problem or what's going on, we can move into problem solving, identifying support. Do other adults need to be notified? What are the pros and cons of these decisions? How can we action plan? Does that sound like a great plan? And then following up with confirming, hey, this is what we talked about for your action plan. Can we follow up in a week, or can we follow up the next day? And then just checking in to make sure that the person calling is getting all of the things that they need. Right, next slide. And then lastly is our phase 3. So phase 3 ends. Our youth may or may not be ready to be on the hotline by phase 3, but usually during this time, we bring in community organizations to speak with our youth and to just let them know about what's going on. So folks that we would like to connect with or have connect with is Youth on Their Own, SAFE, Una Bella Vita, so different organizations just to help our youth be able to support the line better. Yeah, next slide, please. Perfect. So this is an example of our ID initiative. This is actually a current student ID in TUSD where Teen Lifeline is there. Next year, we will have that updated with our 520 number versus the 602 number. But just so you know, this is what the back of the ID looks like and where you can find our resource for all TUSD school IDs. And next slide. Oh yeah, great. Happy to answer any questions. Thank you, John.
Thank you so much, Sunday. I really appreciate that. Again, if there's any questions, please take down Sunday's information, email, and also you can contact Teen Lifeline right here at that number below. That is also going to lead us up to the end of our presentations. Does anybody on the line have any questions for either presenters or anybody else? You can go off your mute and ask, or type it in the chat if you feel more comfortable that way. If not, I'll still wait here. Don't forget to contact us anytime at the pima.gov/healthy schools. You can give us a call at 520-724-7018, or you could reach us at our email, schoolsupport@pima.gov. Thank you, everyone, for joining us today for our first school health update of the year. Our next one will be on in February. Again, we'll have some exciting presenters, and that next date you can put on the calendar will be February 4th at 1 p.m. If there's no additional questions, I wish everybody a great rest of their day. Keep warm and dry if you can. I know we like the rain, but it's also nice to hang out with some sun when we get it, and we will get it. Thank you, everybody. Hope you have a great afternoon. Take care.